Hi everyone, I decided to do my categorical presentation on cerebral palsy. So, cerebral palsy is a disorder that affects muscle tone, movement, and motor skills. It hinders the body's ability to move in a coordinated and purposeful way. It also can affect other body functions that involve motor skills and muscles like breathing, bladder, and bowel control, eating, and talking. There are three types of cerebral palsy. There's spastic cerebral palsy, which causes stiffness and movement difficulties, and uh, dyskinetic cerebral palsy, which causes uncontrolled movements, and ataxic cerebral palsy, which causes a problem with balance and depth perception. So, cerebral palsy is a neuromuscular disorder that occurs as a result of a brain injury sustained during fetal development or birth. Cerebral palsy is caused by damage to the motor cortex of the brain. That is the part of the brain that affects muscle control and coordination. The type and severity of cerebral palsy symptoms will depend in large on part of the extent of the brain injury and when it occurred. There are four primary circumstances that will result in cerebral palsy: prenatal disturbance of brain cell migration. In a developing fetus, cells distinguish and move into place to form the appropriate kind of cell. If something distorts this process, preventing brain cells from migrating and developing properly, CP can arise. Prenatal poor myelination of nerve cells. In the body, myelin acts as a sheath to protect nerve cells, and so insufficient myelin can result in unprotected nerve cells, which can become damaged. Perinatal brain cell death. During the birthing process, brain cells may die as a result of asphyxia or major blood loss. This is most commonly seen in difficult deliveries or periods of fetal distress late in pregnancy that results in emergency birth. Postnatal, non functional, or inappropriate synapses after birth. Brain injury can result in brain damage and CP. Some common causes are brain infection, trauma, and asphyxia. So the incidence of cerebral palsy is the most common motor disability in childhood and affects approximately 500,000 children and adults, with around 8,000 babies and between 1,200 and 1,500 preschool age children diagnosed each year. Because the motor cortex is damaged, individuals with cerebral palsy struggle with walking and fine motor skills. The type and severity of symptoms can vary significantly from one individual to the next. Other behaviors include abnormal reflexes, including excessive or underdeveloped reflexes, poor oral motor function. Excuse me. So some interventions that I looked up that I think would be beneficial would be ankle foot orthosis for gross motor skills. So they are just removable splints or braces that support the feet, ankles, and lower leg of children with cerebral palsy. They also may help children with everyday skills like walking, running, jumping, and climbing stairs. Fitness training can also help improve and maintain their health and well-being, and daily physical activities recommended for children and adolescents. Also, cognitive behavioral therapy can help reduce the intensity of pain and emotional distress that comes with cerebral palsy. The one goal related to PED 415 that I chose to focus on is aquatics. Because muscle tone is affected with CP, adapted aquatics would be super beneficial for individuals with cerebral palsy. Physical benefits of adapted aquatics include increased muscle strength and endurance, improvement in range of movement, improvement in postural control, improvement in overall health-related fitness. Some psychological benefits include boosts in morale, improvement in independence and self-awareness, and provides motivation to want to improve physical fitness. So for those reasons, I think that individuals with cerebral palsy would benefit really well from aquatics.